It is often mentioned that almost half of first cardiovascular events occur in individuals with no risk factors. C-reactive protein, which is usually considered as an inflammatory marker, has emerged as an important cardiovascular risk marker as well. CRP is equivalent to LDL cholesterol as a risk marker. Being an inflammatory marker, high CRP levels also indicate the possibility of plaque rupture leading to coronary thrombosis and myocardial infarction. The current high sensitivity assays of CRP, known in short as hs-CRP, can also predict recurrent coronary events in those with non-coronary artery disease. hs-CRP complements information obtained by lipid profile assessment and other methods of cardiovascular risk assessment. Statins used for lowering LDL cholesterol while reducing the risk of cardiovascular events also brings down hs-CRP levels. Just like multiple lipid profile assessments are useful in cardiovascular risk prediction, multiple values of hs-CRP spread over a time has also been useful in risk prediction. One study included over 53,000 participants with hs-CRP measured at 3 examinations in 2006, 2008 and 2010. Cumulative exposure to hs-CRP was calculated as the weighted sum of the average hs-CRP level for each time interval. Participants with hs-CRP less than 3 mg per liter in all examinations were classified as non-exposed. Those with hs-CRP 3 mg per liter or more in one of the 3 examinations was classified as one exposed group. Similarly, 2 exposed and 3 exposed groups were also determined. There was a dose-response pattern with risk of cardiovascular disease and myocardial infarction as the number of years of exposure to hs-CRP increased. Those in the 3 exposed group had a higher risk than the other groups. The association between hs-CRP exposure and stroke was not found to be statistically significant. Lipoprotein little is known to be an important cardiovascular risk marker, though it is not much amenable to treatment interventions like LDL cholesterol. Data from the 4,679 participants from the multi-ethnic study of atherosclerosis was used to assess the association between LPA, hs-CRP and time to cardiovascular disease events. 684 events occurred during a mean follow-up of 13.6 years. There was a significant interaction between LPA and hs-CRP values. In those with hs-CRP less than 2 mg per liter, no significant risk was observed at any level of LPA, right from below 50 mg per deciliter to over 100 mg per deciliter. Isolated elevations of either LPA or hs-CRP were not associated with increased risk, but the combination of elevated LPA and hs-CRP was associated with significant risk. It was concluded that LPA-associated risk for atherosclerotic cardiovascular disease is present only in those with concomitant elevation of hs-CRP. In other words, individuals with concomitant presence of elevated LPA and systemic inflammation have greater risk for atherosclerotic cardiovascular disease. These individuals merit closer surveillance and more aggressive risk management. Here are the relevant journal references. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.